Hi again. Now we are going to discuss about general aging and tissue replacement treatments and stem cell injections for plastic and reconstructive surgery, as well as fighting aging. Now, to start with, we have to understand the aging. We are having strong bony structures. We have a strong chin, we have a strong cheekbones, we have strong eyebrows. With the time, the skin is sagging not because it is losing elasticity, but majorly because we are losing the bone support. The problem is a deep tissue and deep bone volume loss. Defense against aging is to replace that volume. Naturally, the treatment is supposed to be in relation to it. So we have to somehow get a patient's own tissue and inject it to the places where we lose this support, where we lose the volume. This can be done in different ways. You can do this when the patient is very young using fillers, but they have really a lot of complications, particularly in the lower eyelid area, and they are not as visible. But if the problem is really very small, just lateral sides of the chin, etc., fillers can be a solution. But usually after the age of 40, we need to use patient's own live tissue in order to replace that volume. There's another cutting edge option, which is the usage of patient's own stem cells. Now, when we are talking about stem cells are the cells where you have all around your body, and if you, for example, cut your arm, these are the cells which are going to heal the scar, heal the wound. You can get these cells from everywhere, but the majority of them are residing in the fat tissue, and using very tiny cannulas, I can take a lot of fat. And there are now new techniques where I can isolate the stem cells out of the fat and use them wherever I want. So if I'm fighting against aging, I can take these stem cells out, inject them on the bone in order to make the jawline sharper, onto the cheekbones in order to make the cheekbones strong again, and also onto the eyebrows. So with one shot, we do sharpen the bone support, but also we are lifting the ligaments and the facial system upwards. So we are having a major reversal of aging in less than 40 minutes. To summarize, all these procedure can be done under local anesthesia as well as sedation, but absolutely no general anesthesia is needed. The whole procedure takes around 40 minutes, and the patient needs to stay at the hospital or at our clinic, let's say around 2 to 3 hours. After 3-4 hours, they can go back to their home. Of course, there will be a bit of swelling, might be a bit of bruising, but usually there is not a huge edema or swelling, and the patients are supposed to come back to control after 2 days. Once we see the patients, they can just wash their faces and take a full shower, and after the 3rd day, 4th day, they can go back to their normal life, back to their jobs. Stem cells can be used for fighting aging on the face, but also for breast reconstruction, to fight radiotherapy injuries, acne scars. If there's any soft tissue trauma, all these can be treated by patients on autologous stem cells. So stem cell treatments, fat-derived stem cell treatments, are the cutting-edge treatment of our century.